Thank you, Jeff, for the nice introduction. So I thought, these are my disclosures, I thought I'd give you just a short introduction to artificial intelligence in quite a simple way. I'm not the expert in artificial intelligence, but we hear so much about it. And so what is it? Well, it's really, in a simple sentence, the science and engineering of making intelligent machines, especially intelligent computer programs. So that's where it's in these computer programs, and optimizing them, having them learn and improve, and have multiple computer programs at the same time. And in this way, you get a very complicated, elaborate machine learning tool. So can we distinguish man from intelligent machines? So this was the question asked in the Turing test. Basically, the test for artificial intelligence. So you have an investigator blinded to a subject and a machine and asking a range of questions or problems. And so if you cannot find that distinction, the Turing test has passed, and you say, you know, this is artificial intelligence. An example is Kasparov. I don't know if some of you remember, in 1997, the big point, really, of artificial intelligence. So he was beaten by a computer. Kasparov was the world chess champion. The IBM, I don't know the name anymore, but so it was a big thing, right? So this was really showing that here, you know, the machine was more intelligent, you could argue, than this individual. So this is an example. Can you distinguish the muffin from the chihuahua, right? You know, it probably takes you a couple of seconds, maybe a few minutes. Well, you can train a computer to do this very rapidly, right? To look at various points in there and conclude, you know, so many muffins, so many chihuahuas, right? That's basically the essence. How could AI be relevant to food and nutrition science? Well, a quick search, I did more than 2,000 papers already just on nutrition science and AI, you know, clinical trials, reviews, all kind of studies, models. So data is can be collected from all kind of sources to conclude whether nutrition intakes, food intakes, health are related or can be improved. So all this data, for instance, from social media on behavior, food intake, public health, think about Anne Haynes, a public database on nutrition and health, and trackers, we're going to hear a little bit more about it, health records, patient health records, dietary intake, food safety, microbiome, of course, that generates a lot of data, food composition, and of course the omics, like genomics, proteomics, lipomics, metabolomics, and importantly bioactives. So that's also the area my company, the company I work in, focuses on. So we look at, we identify all these bioactives in plants, in foods, using mass spectrometry and other methods, and then using algorithms really to link those also to potential health benefits. So we have about 8 million compounds now identified in our database, so they are not previously known to man, and they're unique, right? And we try to correlate those to potential health benefits. So that shows you as something that's coming the next couple of years we're not the only company working in this space, but clearly a lot of data. So machine learning is widely used, and it's an area of artificial intelligence, basically related to algorithms that improve automatically through experience, right? So these algorithms get optimized. This is a summary in a paper based of 4 different ways in artificial intelligence. So reinforcement learning, representation learning, unsupervised learning, and supervised learning. I won't go in details because of time, but supervised learning is is a big thing. A lot of algorithms use supervised learning, where you actually have labels to data, and then you train and predict outcomes. So it could be individualized dietary recommendations through lifestyle on health. On the other hand, you can have unsupervised learning. There's no labeled data, and basically the algorithm searches for hidden patterns. You could think about factors associated with muscle mass or risk factors for muscle mass among men and women, and you have this algorithm searching for all kind of possible data. So I try to simplify it, and now it gets really complicated. So I think we can go to the first speaker, right, Jeff?